community of practice. My name is Liz Abbott. I'm a contractor with HLN Consulting, supporting the facilitation of this community of practice along with other HLN colleagues. And then we have multiple ASTO, ASTP, ONC, and CDC colleagues that you will hear from today. So this is just an overview of what we plan to cover today, which really includes an update on what has been happening in the TEFCA space since we last met, and some initial discussion on the future of the community of practice as it transitions to the implementation centers. So as part of this, we are really hoping to hear from you all. If you have any updates on TEFCA related work that your agency or organization has since we last met in August, and then as well as any thoughts you might have related to how you'd like to collaborate in a community of practice type setting in the future. We do plan on having a discussion session as well as a brief Menti poll following some initial partner updates today. So just a few housekeeping reminders before we get started. Please go ahead and rename yourself to include your agency, state, or association, just to kind of help get an idea of who all is on today. Please stay on mute when you're not speaking. And then for discussion and Q&A, please, you can use the chat or select the reactions icon to raise your hand and speak up. If you have any technical issues, feel free to reach out to Lux via direct messaging in the chat. And you should have been notified when you joined, but this meeting is being recorded, so we'll share that out when it's available following the meeting. And one other item for today, we do plan to have a quick Menti poll towards the end, so please be ready to open a browser on your phone or on your desktop to enter the code and participate in that Menti. So, we wanted to remind everyone of the sorts of topics and discussions the COP has covered during meetings from April through August. We have had subject matter experts present high-level overviews on the background of TEFCA, what is TEFCA, what's the structure of TEFCA, as well as more of the technical aspects of TEFCA. Such as how fire fits into the TEFCA framework. We heard from a number of public health agencies. We heard a lot from Fairfax and Alaska and Washington State and Southern Nevada Health District on different initiatives and experience getting started with TEFCA and piloting TEFCA Exchange, such as for electronic case reporting. And we had a really informative presentation in August on legal considerations for TEFCA from experts at ASTO and the National Association for Public Health Law. And then we've, tried to share resources throughout and just learn from each other and been tracking a lot of outstanding questions that remain related to TEFCA. So we're really fortunate today to have experts from across CDC, ASTP, ONC, and ASTO to share some updates related to what is new in the TEFCA space since we last met. First, we have Lily Kahn, who has joined the CDC as Senior Advisor in the Data Policy and Standards Division of the Office of Public Health Data, Surveillance, and Technology. To kick off a round robin update, she'll be followed by Rachel Abbey and Janet Hoy. And then we want to hear from you all on what is new with your agencies and organizations as well. So with that, I will kick it over to Lily to start that round robin.
Great. Thank you so much, Liz. And hi, everyone. It's so nice to be in touch with you. I've seen a lot of familiar names. And so for those of you who might have heard this over the last couple of weeks, as I've been introducing myself in this current role, again, like Liz mentioned, I'm Lily Kahn. I'm a senior advisor. My role within the Data Policy and Standards Division that sits within CDC's Office of Public Health Data, Surveillance, and Technology is really to support the division's partnerships particularly those that have been focused on connecting with health departments, you all, and especially as you all are exploring what early adoption of TEFCA for public health means to you. I, again, have only recently joined the CDC, but I also know that I have interacted a lot with you all as I've worked hard to support your work in different roles in the past. And so that is why I might be a little familiar, even though it's been a while since we've been in touch. But I'm here today to let you all know, and some of you are already aware of this because I know you're part of one of the updates I'm about to share. But about 2 weeks ago, CDC and ASTP, together with our ASTO and CDC Foundation colleagues, convened a meeting to share information about efforts to support early public health adoption of TEFCA, discuss those early experiences, and also use that discussion to identify actions that different sets of partners could continue to take to advance efforts. And really the specific goals of that meeting were to facilitate dialogue, identify alignments, and really inform strategy that should be on the radar of different partners that are engaged in different discussions and taking steps in this space of early public health adoption. The participants included representatives from health departments, including early adopters. Again, I recognize that there were a number of you all who had the opportunity to attend that meeting. Public Health Association representatives were also there, and we also had some representatives from the healthcare space, whether that meant from the healthcare provider space or the health information exchange space. And the actions that the meeting participants generated are focused on what different sectors, for example, federal agencies, healthcare, health departments, what they could do to advance public health adoption, plus what is really needed to do so. This was a relatively small focused meeting, but we certainly recognize the value in engaging more people working in this space. So one of the things I'm really excited in looking ahead, especially to 2025, is really continuing to explore opportunities for future meetings or engagements, and certainly thinking through the different types of engagements and conferences and touch points that you all already have in different ways to talk about TEFCA. For us, it's really thinking through how additional ones could complement those that might already be in the works for 2025. So I think the takeaway point is really we're looking forward to additional opportunities that build on these engagements, such as the TEFCA Community of Practice, to really think through making sure that you all have the information you need, sharing the updates that continue to rapidly happen and evolve as we look ahead to the work. And I think with that, Rachel, why don't I turn it over to you next for your updates before we have questions? And I think it's a nice segue because certainly as we're looking ahead, we're really from the CDC end thinking about this collaboratively with our ASTP colleagues and other public health partners.
Great, thanks, Lily. I just want to say welcome, everyone. Thanks again for dealing with our little hiatus in September, and we're really excited to have you all back here. I hope that you all have been able to look at the new SOPs that have been put out by the RCE, including the public health SOP and some of the others. We're really excited about how this is progressing, and I really appreciate everyone's active participation in this group as well as other groups. Also wanted to bring your attention to ONC's annual meeting, and I'll put that in the chat as well. There'll be some TEFCA sessions there that might be of interest as well to those of you who may be able to attend. Other than that, thank you all so much, and we really look forward to the continued collaboration with CDC, and happy that Lily's on board about this. Thanks.
Thanks so much, Rachel. I think we're going to kick it over to Janet, and then we'll have some time for questions from Lily, Rachel, and Janet before we go into the broader discussion.
Hello, my name is Shannon. I'm a Senior Director on ASTO's Data Modernization and Informatics team. So I'm new to this group, so excited to be joining. So I'm here today to talk a little bit about the Implementation Center program. So I've been looking at the names, I think most of you guys know, but the Public Health Data Modernization Implementation Center program, or IC program for short, is a new multi-year program that is funded by FIG to really help health departments accelerate your data modernization activities. So do things like upgrade to a later version of a standard, adopt TEFCA, things like that. So this program establishes 4 implementation centers that will provide health departments direct implementation support, financial support, and sustainability planning support for projects of your choosing. And this support is available to state, local, tribal, territorial, and freely associated states. So right now there are 3 ICs already selected for shared service, Guidehouse, and Mathematica, who will be primarily supporting states and islands. But then there's going to be a 4th implementation center to support tribes coming out soon. Next slide, please. So for this call, we've got a lot of questions about like, how does this IC program relate to TEFCA? So I think to start off with, this IC program is not just about TEFCA. It does, it's intended to support just general acceleration of data modernization. However, TEFCA is an important component of this program. So this slide I'm showing here, it's a bit wordy, but this slide shows the goals of our IC program. So one of the first ways this IC program will support you all with TEFCA is that through implementation, what we call implementation project supports. So if you see highlighted that outcome 2, one of the goals of this program is to help you all to connect to QHINs if you so desire, participate in TEFCA for priority use cases. And this program will provide, again, funding, technical, sustainability support, legal support for you all to do projects to try this out. Next slide, please. So that's the first way this program really relates to TEFCA. And the second way is through what we call IC program community support. So we'll be working with some health departments to implement projects related to TEFCA, but due to the realities of finite resources, we're not going to be able to do those sort of projects with everyone. So one thing our program is trying to do is be intentional about making sure any findings, lessons learned from those projects can be shared with the broader community so that, even if you're not involved with the project, you can find out what's happening, you can learn from it and maybe shape a future project. So we do this through what we call community support by offering like resources, sharing of like guidance documents from projects. And one specific way that we'll be partnering to do this is we'll be partnering with ASTB CDC to really support this TEFCA community of practice moving forward. I think Liz will chat a little bit more about it, but we really are, the IC program and the national partners are excited to be helping with this group and potentially expanding it so that, it's useful to you all. All right, next slide, please. So that's a little bit about the program, how it relates to TEFCA, why we're here. To close out my update, I want to share a few updates about what this program's up to now and where we are. So recently, we just had the deadline for what we call Wave 1 expression of interest close. So basically, for this year, we're going to support 30 implementation support projects. There will be more opportunities later on, but this is to start. And the deadline for that was in mid-October for health departments to be considered. We've gotten some questions about what types of projects folks are submitting. I cannot share the details at this point. However, I can share that, health departments indicate, whether their proposed projects related to TEFCA or something else. So we did get 6 projects that are solely focused on TEFCA. So it's really just about usually about connecting to a QHIN, trying out TEFCA query, things like that. And then we got 31 projects that the submitter said relates to TEFCA, but maybe, related to other things. So to give an example of that, it might be someone saying they want to wanting to upgrade their EHR system so that they can potentially connect to TEFCA in the future, or someone interested in updating, making enhancements to adopting FHIR so that they can potentially leverage that TEFCA. So that's the type of project that falls in that bucket. So in terms of next steps for this, so we have submitted EOIs. Our teams will then be meeting with those people who submitted projects to really talk more about it. And I kind of picture this kind of like a medical school matching process. So our teams will be meeting with you all, other health departments to discuss, their proposed projects, find out more details. And the goal of these conversations is to make sure this program's a good match. So trying to discuss whether the project does align with what the IC program can provide, and making sure that the types of support that the IC program and provide is useful to the health department. So those conversations will be happening all through November, and then the first initial project selected will be announced in probably like mid-December. So I think that's it for my update. Happy to answer any questions. But if not, I'll turn it back to you, Liz. Thank you.
Thanks so much, Janet. It's great to hear at least some insights into what those applications look like. So we have a few minutes for questions from Janet, Lily, or Rachel before opening it up for some more pointed discussion from you all that we have planned for today. So please feel free to raise your hand or type in the chat if you have any questions for these three. And I'm not seeing any hands up, but please go ahead and go off. Okay. From Rebecca Early in Virginia, when will the groups be contacted for discussion in November? I think that's for you, Janet.
Yeah, good question. So on November 4th, health departments who submitted an EOI will be contacted like, hey, if you're proceeding and then moving forward with scheduling. So definitely by November 4th, and then the timing for scheduling will vary.
Thanks, Janet. Anyone else? Okay. From Marcia, I think in Marcia, are you Minnesota? I'm sorry.
Maryland.
There's a few Maryland. Okay, I should have known Maryland came up in some of our other examples. So sorry, Marcia. So she said, read the TEFCA meeting in San Francisco. Are there plans to share a summary report of the meeting outcomes? So Lily, I think you could take that.
Yeah, Marcia, thanks for the question. I believe so. I would hope so. Let me check internally with my colleagues who really did the heavy lifting for the mechanics of the meeting. I realize I should have been done that to get this information, so I'll circle back with you about that.
Great, thanks, Lily. It looks like a few others are thumbing that up with interest as well. So we'll take note. Any other questions? Okay. So then we have some questions for you all. Let me get there. So again, you can raise your hand, type in the chat to respond to any of these questions that we're pulling up on the screen. And so I'll read through them and then you can think of your responses. First of all, we are just really curious to hear if there's anything new going on in your jurisdiction related to TEFCA since we last met. So this is, from your public health agencies, but we'd also love to hear from any of the associations, partners who are on the call today that might have, complementary TEFCA initiatives that are happening as well. Oh, I'm seeing a hand come up from Illinois. Dejan, do you want to go ahead?
Hi, this is Dan. Hi, Janet, Rachel, Lily, and the rest of peers from other states. So we are reviewing with our legal counselor the TEFCA agreements. Initially, there's no blockage, but we need to go through all the parts of the agreement. We start legal discussion with eHealth of starting to join the QHIN, eHealth QHIN, and we are working on our fire capabilities. So that's all in motion and progress, and we start reviewing with the legal department the different agreements.
That's exciting. Thanks for sharing. How's that going?
So far, so good. Especially, like every single lawyer is very nervous about the take or leave agreements, right? So, but I think that they're making a good progress going through different provisions. They want to know, like, this initial project that we propose is mostly receiving data. So, but they want to know and have more information how in the future we'll use this TEFCA network and what is proposed there. So it's great that they're on board and we are making progress with the agreements.
That's wonderful. Me too. I saw we have a couple. I think we have Lillian from Asto. I think we have at least one person on from, I think Chuck was on from NPHL. So we do have some legal experts with resources through the COP that have shared previously, but just let us know if we can help connect you to any of those going forward. So thanks for sharing. I see another hand from Jennifer, and then I do see something in the chat that I'll go back to from Lynn, but Jennifer, go ahead and unmute yourself.
Hi there, I'm Jennifer from Minnesota, and I can provide a couple of updates. We are what I would call maybe in slightly more advanced planning than we were a couple months ago. We're still not fully committed to TEFCA in that we don't have a concrete plan, but we are grappling with some of the issues and trying to see what makes the most sense for Minnesota. So to give a little bit of background, we have some interesting laws in Minnesota that might make it so that we are not able to do some aspects of TEFCA, which is including the query components. We are working with our legal to better understand what we can and cannot do, and looking at working with some of our potential technical vendors to see, well, how would they go about, doing some type of a query with TEFCA, and to see if it will meet compliance with our laws. But nevertheless, we have heard that it is definitely a top priority of our agency to participate in TEFCA. So we are planning to do that. We're just trying to figure out how and when and for what purposes. We did submit a letter of interest for the implementation center. We're one of the 31 with looking at standards as well as TEFCA. Our focus is on e-case reporting. And I would just say the last one, the questions that I have, this is just me personally, and one of the main roles that I do is we work with a lot of our external partners, healthcare partners, around things like health information exchange in the state. I am really wanting to see over time to what extent TEFCA is adopted across the country, how many transactions are happening, for what use cases, what partners. I think that's going to really help jurisdictions better forecast what kind of value they might see from TEFCA at what points in time. So for example, I imagine there's not a lot of transactions happening yet, but as we see that grow, it's going to be very helpful to see where we're for sure going to want to be at the table participating. So that is an update from Minnesota. Thank you.
That's really great, Jennifer. Rachel, I see your hand is up. I don't know if you want to speak to that value and healthcare adoption or something else. Okay. I know that's come up.
I do.
Great.
Yeah, thanks, Jennifer, for your thought, particularly around the metrics piece. And actually, we met recently with the RCE to help begin thinking through how they're going to be able to measure some of these metrics and really put it out in a public space so that people could see the progress of TEFCA moving forward. And so, so I think it's coming. And hopefully, we really want to put a face on the value prop for TEFCA. So thanks so much, Jennifer, for bringing that to up at the top.
Thanks, Rachel. Okay, I see a few things in the chat. Lily added to that, Jennifer, just that getting info on metrics was a need and theme that came out of the San Francisco meeting. And I know that's a topic that was raised here a few months ago when we had another ASTP presentation. So Lily, thank you. She confirmed there will be a summary coming from the San Francisco meeting and we will share it out with this group. Awesome. Thank you. I'm going to go back up. Lynn, you said you'd love to hear more about lessons learned from PHAs and the TEFCA public health pilot. So thank you for sharing that. Lily, I don't know if you want to speak to that or Rachel, any other this is a setting we can definitely share lessons. We talked about some of the progress with ECR with some more jurisdictions from those that we've shared already for an upcoming meeting. But are there any other plans? Lily, I think your summary report will share some of that, but is there anything else to expand from anyone on the call to respond to Lynn?
I think the only thing that I'll add is, and I think this will nicely segue to a conversation we're looking forward to having with you all at the end is, again, the continued needs that you all have, because that definitely will inform the thinking I know that our ASTO colleagues are also looking forward to doing as they're looking ahead to the future of the community of practice.
Great. And I'll come back to the chat. I see Noelle and some others have added some updates in here. So thank you everyone for sharing. I'll come back to those. I want to get to Chris. You have your hand up. So go ahead and unmute, Chris.
Yeah, here in Washington State, we recently had a completion of the legal review of the Common Agreement 2.0, including the terms of participation. So we're kind of reviewing that now from a privacy and risk perspective, and kind of seeing if there's any mitigations we need to put in place before we would sign on the terms of participation. We continue to receive ECR in production through TEFCA from Legacy Health. That continues to be a very successful pilot, and I'm curious to see with Epic's move to move all of their partners, their customers onto TEFCA by the end of the year, if we start to see more healthcare systems in Washington wanting to submit their ECR through TEFCA. And then we did submit an application to the implementation center process. Specifically, we've been interested in repurposing the ECR framework for chronic disease surveillance. And so that's something we're curious about. Yeah, hope that's helpful.
That is helpful. Does anyone have any additions or questions for Chris? Thanks so much, Chris. I know you had some interesting policies in place there that you guys were working around when you presented last. So hopefully you're making some progress there. Ike, I see your hand up. Go ahead and unmute.
Hey, thank you. And thanks for sharing, Chris. One of the many things I've been looking at is thinking about the provenance of data coming through the TEFCA agreement and the subsequent permissions and ability to use that data for other purposes. As far as I know, there is no provenance information that's included as the source or the path of message coming in through TEFCA. So how are folks looking at including that and incorporating that material in subsequent use of data that they may have received across TEFCA, as opposed to data coming in through other channels?
Does anyone have a response? Rachel, not to put you on the spot. I know, Ike, I think you've brought up some concerns with that and systems being siloed in the past throughout the agency, but
this is actually a different issue. This is not a matter of siloing information. This is a question looking at the reuse constraints that are included in the TEFCA provisions, and how are agencies tracking the data that they're receiving through TEFCA to ensure they're compliant with those provisions on any subsequent reshare where data received from other channels do not have the same constraints.
More compliance and legal concern. I think it's another thing to track. I know a number of these specific legal concerns have come up, and we've been tracking and ASTO's put together some FAQ documents. So we'll continue to track those issues. It looks like Mary Sarah Jones added to that, Ike, in the comments that some data store solutions are adding metadata to TEFCA data to allow compliance. Do you have anything else to add there, Mary Sarah?
Not a lot. Well, so some of the vendors that are in the market are aware of the challenge because you're right, it is a concerning challenge. And so as the data is consumed, it needs to be tagged so that you can use it appropriately. And so there are partners, the vendors out there that are doing this. I'm sure it's going to become more broader over time. I haven't heard of any other approaches, and I'm not sure, like, as it goes through TEFCA even, if provenance is going to get added, because it would be really great to know what state, right, it originated in, because coming from the QN, that may not be clear. But as it's received by a PHA, it can be consumed and tagged so that you are aware that it was not part of the local solutions.
Thank you for sharing that.
Or
I think, Nick, you have a relevant comment in the chat. Do you want to speak up about the reuse of data by sovereign nation tribes?
Well, I'm not an expert here. I can't really expound a lot. I just know that it is a current area of active discussion between, for instance, with the ACR use case between our organization and APHL. I think we need to have some further understanding of that relationship with APHL being a participant of TEFCA as it is, and the perhaps unique nature and stance of tribes being sovereign entities that participate in this ecosystem of things. If there are conflicts, I think they need to be brought forward and be discussed in a more open and transparent venue, because currently right now it seems that there are a lot of discussions, but it's not anything in writing, and it's concerning me a little bit.
I don't know, Janet, if this is an area where the new tribal implementation center is planning to focus and, could be a support.
Yeah, no, I appreciate you raising that. Jim Jellison from NMHI is on the call, can speak more to tribal, but this is definitely something we want to have groups to discuss as part of really to the tribal implementation center, so if they can help facilitate some of that. I think one question for you all would be curious if that should be like a separate space, or would be helpful to have those conversations like integrated with these state and island specific ones. But yeah, I think that's one thing that IC program will want to discuss.
Yeah. Hi, this is Jim Jellison. Sorry, I'm away from my camera, but Nick, good to see you again. Thank you for the question. And yes, in general, yes, as the Tribal Implementation Center gets up and running, it will be, the plan is to work with tribes and techs on data modernization projects that they bring to the Tribal Implementation Center. And we want to be prepared to support their TEFCA adoption if that's what they want to do. And I think as part of that, we'll be having conversations around TEFCA and how it relates to tribal data sovereignty and other specific requirements that might be inherent for tribes and techs. Thanks.
Thank you for that comment, Jim.
Thanks for adding in, Jim. Okay, we've got a lot going on in the chat. Thank you all for continuing the chat. We'll try to catch up on that. I see, Eliza, I see your hand up. Go ahead and unmute.
Hi, thanks. I am with the Alaska Department of Health, and we were one of the kind of early adopter pilot sites, more focusing on the public health query option, and still have yet to really realize a lot of value, mostly due to insufficient facility participation in responding to those public health queries. But one thing that I do want to kind of raise for awareness in this broader group, and I don't know if there's anyone from APHL on this call, but related to what Chris was talking about with facilities on Epic sending ECRs to APHL via TEFCA. There's actually more facilities than just in Washington. There, at this point, it's all Epic facilities, but Alaska is a state that has received an ECR that was facilitated through TEFCA to APHL and then routed to Alaska. And I think that kind of also ties to the questions about provenance, but I think it was almost 60 jurisdictions that APHL cited as having received this kind of ECR facilitated via TEFCA, that it doesn't require jurisdictions to sign on to TEFCA, but as we just kind of start to think about the different ways that these mechanisms and pipes will flow, and it should be available on your AIMS dashboard to see that, you know, certain ECRs are coming in via TEFCA. So just like want to start cluing jurisdictions to be looking for that.
Thank you. These are really a lot of updates since we last met in August. So I really appreciate you all sharing. Let me go back to the chat.
Hey, Liz, I just wanted to respond to Eliza. Thanks so much, Eliza, for bringing that up. I think if we could think about like the whole workflow of EICR data, and that AIMS is now, you know, allowing healthcare to, you know, send EICR data via TEFCA now, versus before where they would have to directly connect into AIMS. So I think if that's a way of thinking about it, it's just like a change in the workflow pieces, but the data is the same, everything else is the same. And so it just, in other words, helps like healthcare providers, one, make the case for joining TEFCA, and two, also helps alleviate some of the burden in regards to directly connecting into to AIMS.
Thank you, Rachel. It looks like Chris also added a link in the chat with some more information on that. We have had APHL participating in this COP. I don't think they were able to attend today, but something for us to track for maybe, you know, a topic for the future to go more in depth. Thanks, Chris, for adding these. And Rachel, I did see you added some language from the public health SOP. Was that more related to the tribal question or the data reuse for other purposes?
Right, yeah,
comment?
around that
Okay.
whole discussion. Yep.
Okay, just flagging that that's out there too. Okay, and so there's so many good examples. I really don't want to skip over anyone. Aparna, it looks like you shared that Chicago is working on multiple fronts for TEFCA ECR use cases, data management, US CDA data model, conversations with eHealth. Is there anything you want to expand on for Chicago?
Hi, we are working on multiple fronts as such. This is the second pilot we're working on with CDC. So right now, we have left the discussion of the pipelines, TEFCA integrations for a later date when we have more informed conversations and understand it better. So we are preparing internally to understand the data model, how we want to address that, both ways, like, because once we do a data modeling exercise, we want to be making sure that it's more expansive and, you know, accommodates everything that CDPH requires for. So our focus is more internal preparation for TEFCA while we wait for all the approvals and work with others, like Dehan just mentioned. We're collaborating to work with eHealth as well, so that, you know, we get the benefits both ways. So that's basically where we are.
Thank you for sharing. I see Noelle, you shared some updates from Fairfax County. Do you want to speak up to those, continue discussions with other early adopters, reviewing possible US CDI data that would be useful, discussion for local healthcare org buy-in, and continued agency division education on TEFCA and updates to leadership. So hopefully you all have been reading through these. Noelle, is there anything you want to add?
No, I mean, there's a lot still going on, right? And I just appreciate everybody's conversations with the other early adopters and with CDC and ASTP and all the other partners. I think a lot of lessons learned, obviously, over the past couple of months, and so a lot of it is really focusing on some of the healthcare organizations to push data back to us. So that is sort of an interesting topic. And then obviously what data, what's minimum necessary, and trying to help define that better. But a lot of work ahead of us, but I think all in a positive direction.
Right. And Lee, with Southern Nevada, you have a few different comments in here. Do you want to come off mute for a moment and share? It looks like you have some updates, as well as you shared out that you applied to the Implementation Center funding to implement the AWS AI for ECR process. Do you want to expand briefly?
Yes, and then we applied the implementation center fundings, and our proposal is work with our state HIE to build the QHands, and then the state HIE will combine the query result from the QHands and from the state HIE database, send us as a ECR. Then we use send the ECR to the AWS AI model, because we work with Amazon's company and California Polytech State University to develop some interface to standardize the ECR, the ECR from the AIMS. Different providers have a different format, all the information, some hide in the notes section, like travel history, all those kind of things. And then we hope we can use AWS AI to standardize all those important social histories and in the standard format. Then we fit into our disease surveillance system. That's our proposal. The lessons learned is needed involves your legal department and IT that Chris mentioned is as soon as possible, because I know our leadership is very supportive to join the TEFCA. We are early adopters and very supportive of the TEFCA project. But when I ask our legal said, do you have any concern about the TEFCA common agreements? You always ask me some interesting questions, and then you have to go through the standard protocol, some is a common agreement, all those things to the legal review process. So that's why I will give the big thanks to the Neil is from Fairfax County, and he gave me a lot of tips how to work with state HIE, work with your legal department. So we had a meeting with the state HIE yesterday, and then there is, besides the common agreement, we will put some new closet requirement in order to you guys become the sub-participant. So I said, send those over, and then I will send to our legal team to review. Hopefully we can get the agreement signed by end of this year. So
yeah, moving forward.
Yeah, that's the thing. If you want to work with your state HIE, be a sub-participant, you have to make sure if they have some additional requirement in order to your health department become a sub-participant. Because the common agreement is so generic, as general, don't have any issues. They have slight different. So that's all I have.
Thank you, Lee. Thank you. No, there's so many details that I'm sure everyone is interested, but it's good to at least get sort of an idea of what's going on where for people to be able to follow up. And I know we have a lot more in the chat, and I think this is the most important part of the meeting. So I've let us go a little over our discussion time, but I know Phil and Dallas put some great information on what they're up to, some other examples of other applications. So please feel free to read through the chat, and we will do our best to capture all of this at a high level in notes after the meeting as well, and provide more opportunities. I think this gives us a good idea of who's doing some things in different places that we can come to you to share in more detail at future meetings as well. So I am going to just move us on for the sake of time. And then if we have any time remaining, we can come back and hear a little more. So thank you for all the great examples and sharing and information in the chat as well. So we're just going to take a couple minutes to talk about the future of this community of practice. We kind of started to delve into this a little bit at the last meeting, and it will be a process, but this is sort of an update on what's coming, what to expect over the next few months. So although we paused in September, we wanted to continue the momentum of the prior version of the COP and capture your feedback to inform a future COP. And so the current plan is to host another meeting in November. It is going to be on November 20th. We will follow up with a calendar invitation to you all after this meeting. And then we'll work with the IC partners to transition the community of practice to the IC program officially in January is the plan. And that will provide opportunities to expand participation, to make any necessary changes to how things are structured currently, and really most importantly, to continue to provide a forum for sharing what's going on the ground in your jurisdictions and for learning from each other. So your feedback will be really helpful in crafting what this looks like. And I just quickly want to share, I don't want to spend a lot of time on this because we're running out of time and we want to hear from you in the Menti, but in August, we did ask a couple questions to capture what's been valuable, what you'd like to see more of, what you would change related to a future community of practice. And so participants of our Menti poll in August expressed interest in more legal discussions, sharing of use cases, lessons, and best practices, and integration. And so kind of a lot of what we were just doing now, I think is what you want to see, more of these examples and learning from each other. So related to potential changes, I think we had one recommendation to consider creating COPs that focus on specific promising but distinct use cases. So I just wanted to share these to get you thinking about any additional feedback you might want to share through the poll in just a moment. One more slide. You've seen one rendition of this. We've expanded slightly. We have been tracking and categorizing topics of interest since we started meeting. These are just high-level examples of key topics that you've shared as part of various polling exercises. And we pulled in a couple that were shared in a presentation Lily had given a while back as well. So I just thought we could take a moment to review these as a starting point, again, to kind of get you thinking for the poll that we're about to launch in case there are other topics or if some of these still really kind of continue to be of top interest to continue discussing for you all. So again, I know there's a lot more detail under a number of these, but we've heard a lot of interest in continuing to talk about potential and existing use cases, the legal considerations always coming up, the roles of various entities, so the implementation centers, the HIEs, the QHINs, the healthcare community themselves, and just, what does that value add? A lot on data governance and a lot of the things that came up today. So I think that leads us to our Menti, and I'm going to go to the instructions first, and Lux is putting those in the chat as well. So please go to www.menti.com and enter the code 44940897. And then Lux will go ahead and pull up the Menti on her screen. Lux, are you able to share and pull that up?
Yes, it should be up. And if everyone starts giving a thumbs up, then we get an idea of how many people have joined. Thank you. And the first question is displayed there.
So the first question is, are there specific TEFCA tools and or resources you would like to see come out of a future community of practice? And Lux, I don't know if you can share your screen to share the results that are being populated. Lux, are you seeing responses come in?
Yes, I do see responses, and I'm just trying to get my desktop to be shared.
Thank you. Oh, great. Sorry for the slight delay, everyone. Thank you for your participation. It gives you an extra minute to get signed in there. Okay, so some resource examples. AWS AI. I'm sure someone wants to hear more about that since we heard from from Lee. Federal updates, how to show the value proposition to healthcare partners, more on use cases, legal framework, technical architecture. These are great. How to mitigate risks, QHIN capability, legal privacy Q&A, evaluation data and our communication guides of the potential value for healthcare organizations. Tools to promote healthcare participation to be useful. ECR CCD data standard for public health necessary data, security Q&A. Lux, can we scroll back up for a second to see? I know I missed some. a lot coming up on working with healthcare partners and presenting the value to them to increase participation and ultimately the value to you all, and how to use TEFCA for ECR. And as you guys are writing these, Mary Sarah did put in our chat a link on the AWS AI, so take a look at that. Okay, well, we'll capture these. We're going to move on because we have a few other questions, but we will take note of those. Are there any changes you suggest related to the community practice structure and or the membership? So this, to remind everyone, this current community practice has been a little more limited based on who was really showing that they were early demonstrators, and some associations in this space, but you know, I think this will be expanded down the road. Any other changes that you would suggest to how these have been going so far? Can be honest. Oh, Lex, go back. Thank you. To add a couple more people per jurisdiction. Yes, we did have to limit that initially. And you know, I think we really have to think through how to do that with leaving it so that people still can speak up and have time to participate. Pull in those who get EOI approved via the ICs. Definitely. Any other thoughts? And you can always add this feedback in the post-meeting survey that we will share out as well. So this is not your only opportunity. Agenda and topic items ahead of the call to better prepare. Yeah, I think we try to send very high level in the reminders, but absolutely. All right, let's move to the next question. So some of these came through on that first question when we were asking more about resources and tools, but thinking through the topics that we shared on the slide previously, as well as anything that we didn't have on there and kind of what you heard today, what would be the top 1 to 2 topics that you would want to see addressed at a future COP meeting? Where are you most interested from your standpoint? Or the greatest need, I guess. Anyone? Do you feel like we captured them on that earlier slide? Were there things that raised to the top for you all or that we're missing? We had legal use cases, that healthcare provider perspective. Oh, great. And I'm sorry, this was set up as a word cloud, so that might be the challenge. We have to say this in just a couple words. So feel free to type in the chat as well if you want to say something longer than the word cloud really allows for. Roadmap of TEFCA efforts. Janet, I don't know if you have any updates. I feel like ASTO at some point was working on some sort of roadmap. Not to put you on the spot. I don't know if that's the case, but
Yeah, that's correct. Aston's been working with Guidehouse, and there's we've been calling it a user journey, which is kind of like a high-level roadmap to getting started for TEFCA. And that was one of the ideas for a future COP call. So glad to see it on the board.
Great. These are great metrics, healthcare participation, overlapping jurisdictions. So we saw King County responding along with Washington and Chicago and Illinois. Governance, sustainability, mitigation strategies. Great. Thank you for these. We have a few more seconds here. We have one more question and then like 1 or 2 wrap-up slides. Okay, let's go ahead. I think we'll do the last question and wrap up. So the final question is just, is your agency or jurisdiction currently exchanging public health data through TEFCA? Yeah. Limited, we know. It's interesting to see. Most are no's. Getting a couple yeses. I know we just have 1 minute left. So I'm going to go ahead and jump back to our presentation. Thank you for all participating. I need to pull my slides back up, but basically I just wanted to share we have a post-meeting survey for next steps. So Lux is going to place that in the chat. We'd love any feedback related to any of this or other ideas you have going forward. And then let's see. Oh, we did have a resource in here for anyone who missed the TEFCA RCE webinar on October related to the public health exchange purposes implementation SOP. There's a recording that Lux just put in the chat for that. And then related to next steps, again, please look out for that calendar invitation for the November 20th meeting. And we'll be reviewing topics that came up today, as well as some other things that have been discussed by the planning team to form what that meeting is going to look like. And we'll keep you all posted. And thank you for your time and engagement. Here's contact information for those of us who presented, although many others are deeply involved in this work. So we look forward to connecting with you in November. And thank you all for all of that sharing today. It was really great. There's so much more that we didn't even get to get to from those examples. So we'll have other opportunities in the future. Have a great rest of your Wednesday. Thanks, everybody. Happy Halloween. No, Janet, I think you guys are good to drop. We can leave it on for a second, Lux, in case anyone's copying out that survey, but we can send it in the follow-up as well. Thanks, everybody.
Thank you.
Thank you.
Thanks, Jim. Bye, guys. Have a good day. I think we can close it out, Lux. Thank you.